Today, our next topic, we are having the cardiovascular disorder. What does it mean? Cardio, as you guys all know, the heart, and vascular, we are having blood vessels like arteries, veins, and many branches of the blood vessels. What is disorder? Let me explain you the difference between the disease and the disorder. Okay, disease is basically the illness with their symptoms, illness with the symptoms, specific symptoms. Okay, if we talk about disorder, so disorder is basically the problem or the defect or the or you can say the irregularity in any organ or in any part of a body. Irregularity, defect or a problem, but this is an illness with the symptoms. Okay, so first cardiovascular disease we are having, that is thrombus. What is thrombus? Thrombus is basically the disorder that is disorder related to blood vessels. Related to the blood vessels. The thrombus, we are calling thrombus as a blood clot. Blood clotting. Okay, so, or you can say that the formation of the blood clot we are calling as a thrombus, and this process, the formation of the blood clot, that we are calling as a thrombosis. That can be seen in the blood vessels, heart, blood vessels like veins, like artery, like in the heart. If the thrombus is basically found in the veins, we are calling that as a venous thrombus. The blood clotting in the veins. If we are finding the blood clotting in the heart, we are calling that as a cardiac thrombus. If we have found the blood clotting in the artery, we are calling that as a arterious thrombus. But in major cases, the thrombus is basically, you can say that they are having the, like in major cases we have seen that the thrombus is basically, you can say that, found in many cases. The thrombus is of the veins. They are they are also having a patient, they are also the patients which are having the thrombus of the heart and artery, but mostly in the cases we are having the thrombus of the veins. Why? Because as you guys all know, veins is having the, you can say that the, as you guys all know, veins is having the less pressure, so less pressure are having, so less pressure of the, you can say, the blood flow, so the clotting will occur more in the veins. Clotting occur more here. Okay, this is the first reason. Second reason we are having, that is that is the veins is, as you guys all know, are having the walls, like this was the structure, this is a wall, not wall, this is the vein, for example, and we are having the, you can say that, the wall here. For example, as you guys all know, the semilunar valve. Okay, semilunar valve. So here you can see that, for example, the, this is semilunar valve through which the blood clot can be hide. Blood clot can be hide. Okay, so through this the flow of the blood, basically you can say that, become less and the blood clotting starts more. If we talk about the artery is having no wall, so if there is the blood clots, the blood basically move from here to there, but there is the, you can say, the blood flow is there little bit, but here you can say that there is like too much less flow in the veins. So that's why we are having the major cases is having the, you can say that, the this venous thrombus. Okay, if we talk about the causes, that what's the reason of this thrombus, that is the injury or surgery Okay, we are having the fibrinogen platelets. If they basically increase, like platelets increase, platelets, as you guys all know, the platelets basically work as a blood clot. Okay, if the fibrinogen increase, okay, so these are what, these are the plasma protein. Okay, so when the, you can say that this these both get increase, so the blood clot get basically get the more blood clot will be occur more in the these you can say that veins, heart, arteries, if there is any kind of thrombus. So there if these both basically increase, so there the blood clotting will be start increase, that will start in increase, like increasement of the blood clot will be occur. Okay, so when the blood clot will be like you can say that occur in these three like a thrombus, so then the blood flow will get decrease, blood flow will get decrease, and it can cause a problem too. Okay, for example, we are having the heparin, we are having the heparin in our body, as you guys all know, heparin plus plasma protein we are having. When they both get decreased, what's the function of the heparin? Heparin is having the function that prevent from the blood clot. Okay, when they will get decreased, so the, so they will not prevent from the blood clot. So heparin is basically less, so the blood clot will be occur more, and the blood of flow will be getting decreased, so that can cause a thrombus. Okay, we are having, likewise we are having the embolus too. What is embolus? Embolus is like is the thrombus. This is also the thrombus, like blood clots, but the blood clots, but the moving blood clots that can move, that can move with the blood. So this is what blood clot is, a thrombus, and the moving blood clot we are calling as the embolus. The both we are combinedly we are calling as the thromboemboli. Okay, basically it is common in the pulmonary pulmonary, there is basically common in the pulmonary embolus, because if there is the, there is embolus in the pulmonary, so pulmonary you can say that the vein, because that supply the oxygenated blood, so in the heart, so that can cause the difficulty in the breathing, and you can say that the many other problems too. Okay, if they, this embolus is in the coronary artery, coronary artery, so that can cause a heart attack, because of the more blood clot. Okay, so it is like dangerous where the, you can say, branches are there. For example, we are having vein and we are having the branches here. So here if there is a blood clot, so how the blood will move? Okay, how the blood will basically move? Okay, they are having the narrow lumen, how the blood will be moved? So this is basically more critical than the thrombus. Okay, so that you can see the blood, there is the blood clot, so the blood will not flow, that will stuck, so through that the blood flow will get decrease. For example, if the blood is oxygenated, and the blood, oxygenated blood is moving to the cells for the nourishment. For example, in the branches here is, for example, there is oxygenated blood and there is the blood clot. For example, the oxygenated blood is basically want to go in the cells for the nourishment of the cells and for the growth. How this oxygenated blood will move through this, you can see the blood clot, that will stuck. Okay, so that you can say the blood flow cannot occur, so through that the death of the cells can be occur, and that can be the, you can say that, harmful for our body. Okay, if we talk about the treatment, if we talk about the treatment of this treatment, so treatment is basically the medicine heparin, which can increase the heparin, and then heparin will be heparin will be prevent from the, you can say, the blood clot. Okay, but that will be prevent from the blood clot. As well as this, they are having the medicine, the heparin, which can increase the blood flow. Okay, blood, we are having the blood thinner medicine too, blood thinner medicine, as well as we are having the anticoagulants too, which will prevent from the blood clots. So these are basically the small treatment through which the blood clot will be decreased. Okay, so this was the first cardiovascular disorder. In the next video we will discuss the next cardiovascular disorder.